We're coming to you live from Doctor Petrus Molemela Stadium here in Bloemfontein. People are already making their way in to the stadium to, of course, commemorate the World AIDS Day. You have just indicated that the keynote address was supposed to be given by the Deputy President, David Mabuza, but now we understand that he's got other responsibilities in Parliament that he has to attend to as a leader of the government business. But now we will be expecting the Health Minister, Dr. Joe Phaahla, to give that keynote address. Going back now to today's, we know that there is still an issue of primary health care, the access to primary health care in the country. And also, when we were talking to some residents yesterday, when I was doing a preview, going to clinics, to those people that are, of course, frequenting the clinic to take their chronic medication, they are saying that there's still a stigma that it is supposed to be addressed. They are being sidelined in the society. Those are just some of the social ills that they are confronted by. But I just want to bring now the General Secretary of the Positive Action Campaign. Thank you so much, Sir, for your time. Let's talk about the issue of the defaulters. You mentioned that in the province we have high number of defaulters, people that are supposed to be taking their chronic medication.
Let me start first by thanking you for having us, for interviewing us on this critical issue. Yes, in the province, the reason why we've got the World AIDS Day main event, national, held here in Mangaung is because of the high number of defaulter rate that we have, which emanates from various challenges that we see from the health system. But then most of all, because from the 7th we've been on the field doing social mobilization, trying to find out what are the challenges exactly that prevent people from accessing treatment, and we realize that most of the challenges emanate from the health system itself, from the facilities. Some they are challenges that cannot be resolved within the facilities. It's more challenges of shortage of stockouts. These are the challenges that prevent people from getting treatment, from adhering to treatment. At some point, the long waiting queues become challenges as well, where people decide that they'll never go to facilities as well, especially situations where someone has to go to the facility in the morning and they are returned without the treatment. And you think about, for them to access the facility, they have to take maybe double transport where people are not unemployed. That is another challenge. So these are the factors that we're looking at, and we think government will assist us in terms of addressing this, because we've partnered with them. We've been working with them doing social mobilization in Mangaung. Remember, as Mangaung, we used to be the best district ever. However, ever since all this COVID started and up to date, there's been challenges around HIV. As people living with HIV, we're saying it can't be that people are struggling on HIV, whereas we've got the program of U is equals to U, where we know that treatment works as prevention as well. It can't be that people are struggling as well and people are dying on TB, whereas we know that TB is curable. These are the challenges that we are expecting a plan from government to say this is what they're going to do.
Let's talk about the issue of stigma. It's still a national debate whereby people are saying they don't go to the clinics because there is that, treatment that is not equal to the ordinary citizen.
Stigma is very rife, especially on people living with HIV. Remember, during those times when we tested for HIV, psychosocial support was the element that was strengthened on the healthcare system. However, at this point in time, it's like we're chasing numbers instead of looking at of providing the quality healthcare service to people living with HIV. HIV is a life-threatening and life life-threatening disease and life-threatening virus, whereby when you diagnose someone with HIV, you can't expect those people to accept their status immediately. There has to be continuous counseling for these people. That's the first one. Now you get stigma from people who are supposed to provide healthcare services to you. People will stand up and say, those ones with HIV, come this side. That's a problem on its own. So these people have not disclosed. There's people around, some might be the neighbors, some might be family members who came for certain healthcare services. Then they hear that someone is HIV positive. So it's indirect disclosure. So that's what prevents people as well from going to facilities.
Mr. Mokalepi, we are from strict regulations of COVID-19. You did mention to me yesterday that government is making that as an excuse in terms of improving the issue of access to health facilities. Now, stepping outside those regulations, are you saying that there is a change somehow? And what are you doing on the ground to make sure that you keep those people with good spirit?
I can't generally say there's changes. We're trying to bring changes now as activists. But remember, the people who have resources is the department, whether we like it or not. And the changes that we can bring are minimal. It's just to advocate to advocate for communities to access services. However, the biggest changes has to come to government. Then the people who has power, it's politicians. We may talk as much as we want about regarding the treatment that people get from officials. However, officials are also frustrated because people who are taking decisions are not people who are on the ground. It's not people who are on the facilities. In order for them to know what's happening within the facilities, us as activists, we have to go there, we have to monitor, we have to make sure that they know that. But then the biggest challenge becomes when we monitor the services and when we come try to report, we are seen as enemies. Remember, we're doing this as people living with HIV because we know the pain of not accessing services. We know the pain of living without ARVs. We know the pain of taking ARVs on empty stomach.
There we have it from Ndadeselo Mokalepi, of course, from Positive Action Campaign, saying that the issue of stigma is still something that needs to be dealt with, and also talking about the issue of access to primary health care, and of course the treatment of the services that are supposed to be rendered in these healthcare facilities, saying that government needs to improve its way of doing things when it comes to these issues. It's back to you in studio.
For that, our reporter Aphumelele Mdlalane is speaking to us from the World AIDS Day commemorations as they unfold in Bloemfontein, where there was the expectation that the Deputy President David Mabuza would be giving the keynote address. It's going to be given instead by the Health Minister.